Welcome back to another episode of Questions with Crocker with me, Dr. Crocker, and my husband, Shane.
Me.
How are you?
I'm good.
We're here. We're back.
Yes. With my second cup of coffee.
Mine too. It's been a couple weeks, and we took off because we had a ton of travel and work, and honestly, everyone was sick, me especially, and it just felt like a good time to take a little break, which we're not great at.
No. I'm good at taking a break from the podcast. I don't think I've been on a podcast in a while.
You haven't, and I have missed this. So we have a lot of catching up to do. A couple things. I did my last conference. I did Fetch Long Beach in California, and I will say the weather was beautiful. It was on the water. I had a really good time. How were you and the kids
I was not there. I was here, and the weather sucked, and the kids were busy.
You held the fort down.
Everybody survived.
My favorite thing is I feel like I always get questions of, how do you do so much? And I just say, Shane, like, you're the reason that I can do so much and go so many places, because you definitely hold the fort down, handle.
And the kids kind of take care of themselves at this point.
That is nice, yes. When we were traveling the other day, there was someone that had, toddlers and little kids, and she was juggling all the things. And I will say the husband was not that helpful. And I just looked at her and I said, it gets better. Like, they can dress themselves eventually. Mine pack themselves. Like, when we go on a trip, they're very self-sufficient. And that does make it a whole lot easier, for sure. So just a little bit about us, in case you're new to the podcast. It's called Questions with Crocker because I'm an emergency veterinarian. I own a general practice, and Shane helps run it with me. And basically, we answer your questions. And then we also talk about all things VetMed related, things going on in the industry, exciting cases that I've heard about at the ER, pretty much whatever I want to talk about. You can listen to us on Apple or Spotify. You can leave us a review. We would love your feedback. And if you want to send us questions, you can follow us through social media at Questions with Crocker.
They can watch us on YouTube.
They can watch us on YouTube. I think you're the YouTube person in this relationship.
I watch YouTube golf. Let's narrow this down a little bit.
You don't want people to think you're just watching like random...
And force modifications.
You watch that, but then also our son watches all the YouTube videos that I feel like YouTube's really known for. I didn't even realize they had the golf on it they had until I kind of asked you a couple times what you were watching. And the other day you watched something that was like hours long.
Yes.
What was it?
That was the Internet Invitational.
Okay. And I'm sure people that actually golf maybe in YouTube know what that is, but I do not. So, what about you? Would you ever put your golf game on YouTube?
I don't think people want to watch that. That's not something that people would subscribe to.
I don't know if that's true, because I've actually seen I've seen a couple on social media, and she basically was like, if I can shoot, is it below 100? Is that good?
It's not good, but I hope they shoot below 100.
Now you can see how much I know about golf. If she could shoot below 100, she got to buy a certain designer bag. And so they do videos where they go and golf. And she always starts out with I'm feeling so good. I'm doing so good. And then it just goes downhill. So they've been documenting that. And then there's some guy that's he calls himself the average golfer. And he just goes out there and plays and puts it on YouTube. And people tell him basically what he's doing wrong.
Like the old man golfer, the dad golfer.
The dad golfer. You could do that. We're trying to get our daughter into golf because right now she plays club volleyball, and genetically she's just not the biggest kid. We have a lot of strengths, but height is not one of them. So we're in a competitive district. So we've kind of been trying to see if we can direct her gently to some other sports that might be a little bit better. But for now, she's locked in. She's competitive. So we'll see what happens.
We'll see.
Your dream would be, though, if she did golf, that'd be kind of cool for you.
That would be nice, yes. It's
kind of like me. I would love if my kids did horses, but
I would not love that. That sounds very expensive.
I grew up riding and showing horses. And honestly, as a kid, it was an amazing experience. I did not realize how expensive it was, though, if that makes sense.
It does, yes.
But you would definitely be aware of how much it was, because that's the type of person you are. And you probably remind me of it all the time.
We would do that.
One of my goals when I eventually do slow down in life is to get a horse again and ride again. So you just have to balance that with the fact that you want me to slow down a little bit. But that might mean I take on a hobby, a true hobby that's not VetMed related. But speaking of our life, I kind of give a little update on me. One other thing is I do work emergency shifts. own a general practice. I've actually been at the general practice a little bit more because one of our doctors, her daughter went to the NFR. So I covered some shifts. And usually when I'm at the general practice, I like it, but I'm reminded of like why I like to do ER because all the dog ear infections, all the skin, it kind of can get a little repetitive, which for my personality is a little harder. But we actually had a couple days where we had a lot of different things and it was exciting and a lot of interesting cases. So it was fun. And then we had a vet student come visit and we spayed and neutered little 2-pound kittens. And just, it was fun having like that young energy around. We did a splenectomy. What's a splenectomy?
I assume you're taking the spleen out.
See, good. Ectomy, take it out. Yes, we were actually scanning a dog, an ultrasound, because it was like vomiting a lot. And so we were kind of trying to figure out what was going on with it. And its stomach was very thickened. It had a little bit of gastritis. But when I was scanning, you do a full scan of everything because if you're doing it, you might as well be thorough. And we found a nodule on the spleen. And splenic nodules, when you find them, they can be benign. Or they can be aggressive. So it is a mass and it can be cancerous. So the recommendation, especially working ER and seeing so many of those come in ruptured bleeding masses where they need emergency surgery, is to just remove it so that you don't have to worry about that happening. And so the owner was very nervous because this is a surgery not to be taken lightly, can have complications. And honestly, it was a couple weeks process of like talking to her about it, giving estimates. We rescanned, was still there. It was a little bigger. And so she eventually decided to do it. And we did the surgery. The vet student actually got to help. So that was cool. And we just got the pathology report back and it was benign. So the good thing is we removed the problem and the dog won't have it like rupture and bleed anymore. But the even better news is it's not the type that would have spread like anywhere else in the body where we expect masses to pop up elsewhere.
Nice.
Yeah, it was a
So
big
that
one.
caused it to throw up?
No, good question, though. No, the throwing up was a completely separate issue. It just had gastritis, like an upset, inflamed tummy, and we put it on meds to kind of quiet everything down. All the GI throwing up stuff completely resolved. We changed the diet up a little bit too. But it was kind of cool to also find something that could be like life-threatening and be able to fix it, which is why your veterinarian recommends full workups on things because, you know, even for like preventative imaging or preventative blood work, there are things you can find that will actually, you know, one, save your dog's life in the long run, but also save you money because the owner was like, if this ruptured on the weekend and, you know, we had to go into the emergency hospital, how much would it cost? And I honestly was like, it can be like $8,000 to $10,000 because it's emergency surgery on a weekend or middle of the night. They often need blood transfusions at that point. They're very sick. They have to be hospitalized usually 2 days or so at least. And so it adds up really quickly. So this is something that we were able to do for a lot less. I think we did it for like $1,000 total. And she was very happy. We were too with the outcome. So I don't know, those little things. It's nice when you find something and you can help a dog long term like that.
Infections.
We are wrapping up the end of the year and you're the finance guy. So how did I do this year? I feel like I should get a report card for my general practice. How did we do? Do you want me to give you categories and you can grade me? Or is this dangerous for our marriage?
It's pretty dangerous. I think the overview is the hospital is doing really well. I think we're profitable. We are working with our tax consultants to try to get the profitability down a little bit.
Oh,
so
okay.
We're not paying quite as much in taxes.
Okay.
We just bought a dental x-ray. It's much needed.
We did. Everyone's very excited. We got handheld. So it
sounds expensive.
And
it was very expensive.
It was very expensive. But it also will help decrease our profitability and our taxes.
Yeah, I think so.
Is this like when I find something on sale for like 20% off, but you're like, you're still paying
this is Starbucks math.
Starbucks math is just mental happiness math. That's all that is.
But yes, the hospital's doing good.
I will say one of the most important things you've taught me is to not run a business based off of feeling. So the last month, probably things are slower. It feels slower, the economy, the shutdown, everything that happened. Like our schedules will book up during the day, but we're not full going into each day. And that's a little unsettling But we also added a new doctor in May. So we, increased our availability overall. But when you're, at work those days and it's slower than it normally is, I think as an owner, especially, you start to kind of look around and be like, are we not successful? Are people not coming in? And so I think I've had a couple moments, just a couple, where I've kind of freaked out a little bit or been very in my head about it and wondering, especially if I was doing a good enough job. And what have you told me or how have you helped me work through that?
Let's sell it.
You did say that one when I was spiraling, which shocked me. It's our third child. We can't just sell our third
No,
child when we have a hard
we
time.
can sell kids. I got 2 other ones.
You have like no emotional attachment to any businesses. Anyways, other than selling it, what do you tell me and help me with and help me to
You just got to go back to
focus
the
on?
facts. I mean, the facts are the business is growing. It's growing at a rate higher than most businesses grow. When you have, fast growth, there's going to be bumps in the road. There's going to be things that don't feel right. There's going to be things we have to work on. But you just have to go back to the numbers and realize it is a growing business and a growing entity, and we're doing the right things. I do think VetMed is getting back to the new norm, which is pre-COVID. And I think you're going to continue to see this be kind of the norm going forward. It's not like it was in COVID where everybody was at home. They were around their animals 24/7. They were picking up extra animals because they were bored. They were able to see a dog limping because they're there all the time with it. So I think we're back to kind of pre-COVID normalcy. And I think that does kind of create a slower environment at the vet hospital. That's my opinion.
Yeah. I mean, I think in general, some of the things we've heard from consultants and other people is that, we need to do a better job of focusing again on preventative care.
Yes.
So really stressing the importance of that, getting people in the door to do those workups when they're there, really making sure that we're talking about why we're recommending, annual blood work, why we're checking fecals, and getting, vaccines up to date, because we really did lapse a lot on that in VetMed for a while because we really were trying to fit in all the same day urgent care, emergent things. And it was so busy that when it's just rolling in the door, you don't have to focus as much on, crossing your T's and dotting your I's. And so I did print a sheet just of people that were lapsed on vaccines over the last, I think I did 18 months. And it was actually great. We worked through like the entire list. It was a pretty extensive list. And it was nice because some people were like, we get vaccines at a low cost place, but we come to you for emergencies, but we can like disable the communications for vaccines for them. Some people had moved. Unfortunately, some people's pets had passed away, but we were able to really like clean up some of our communication lists and things like that. And just check back in with people. And we consistently every day, we're getting a couple people saying, oh yeah, I do need to update my vaccines or my preventions. And so we were booking an extra, 3 appointments or so each time we were making the calls. So I felt like it was helpful. And those are the little things that you can do as an owner to kind of look at, who can we contact? Who can we kind of show that we're here and we're here to help, but also talk about, the value of what we're doing. But it is hard right now because the economy is tight. It's the holidays. We always see a decrease in people wanting to spend money on things that aren't urgent, which I get, right? I'm Christmas shopping right now and it's like kids are expensive.
Yes, very.
So if you're trying to decide between, preventative lab work on your 3-year-old dog that looks super healthy or providing, your kids or your family with the Christmas or holiday that you want, like I get it. So right now we're focusing on continuing to grow. But it is good for you to remind me we are more profitable than last year. We are seeing more people. We just have more availability too. So yes, those things kind of all coincide. So decrease in preventative care, but one thing that we have not seen a decrease, and we actually see an uptick in, and I've talked about it before, but we see an uptick this time of year in euthanasias during the holidays. We've kind of talked about why that happens before. What do you remember from those conversations?
Kids are back in town and all that fun stuff.
Yeah, a lot of people, if they have a pet that's aging or declining or even has a chronic condition they've kind of been trying to manage, they'll wait until, family or kids are in town so that the kids can be available, like grown-up kids, to, be there with their pet, which totally makes sense. I also think that some people, because the holidays are overwhelming, they're trying to travel, if there's other things going on, then maybe it's a time that if they have a pet that is very high needs and has been declining, that it's a time to make that decision and be able to do some of the things that they needed to do. Not to say they're not sad about it, but there's like this weird thing where you have anticipatory grief that it's going to happen, but then after you make that decision and it does happen, a lot of people do get a little bit of relief if they've had a pet with like a very chronic issue. And then I think finances, do play into it. And some people would love to say, finances shouldn't play a part in making decisions about pets and their care, but how can it not? I mean, a lot of times these things are not things that are easily fixable or cheap to fix if they're especially emergent or urgent. And so it is a balance for sure. And it's always a hard conversation. I had a couple cases in the ER this last weekend that were very difficult. And one of them was a cat that had it was like a 1-year-old cat. It had been a stray, never had vaccines, and all of a sudden was vomiting, not eating.
Splenectomy.
No, actually, cat splenectomies are very uncommon. I've only had one that I've taken, a spleen out of. But she had a fever and she had been treated symptomatically, like given fluids and anti-nausea, did okay for like a day and then went back to vomiting. And so I was seeing her kind of 5 days after that time that she was seen at the emergency room. And the guy was super nice, but the cat was very dull, very lethargic. She did have a high fever that could contribute, but you could just tell she felt real bad. So he was on a budget. I recommended we check like her basic CBC, so her white blood cell count, her neutrophils, because I was a little suspicious of some diseases that can really obliterate the immune system, and that can be why they're so sick. Do a SNAP test to check for FIV, FELV, and then I wanted to do an ultrasound to look at her belly and just see if I could see a foreign body or something else. So we did her blood work, and all of her white blood cells were almost zero. So she had low white blood cells, neutrophils, lymphocytes, eosinophils, everything. What do you think that means? And do you think that's good or bad?
It's not good. I don't know anything about medicine, but
good job, Dr. Shane.
It's definitely not good. I have no idea what to call it, but
so it's really bad when they're low. It's when they're leukopenic and neutropenic, meaning they're low. It means one of two things: either the infection's early on, and it's just all the white blood cells are going into the body and leaving the blood, basically. But the more likely thing is the body's just not responding to the infection. So it's using white blood cells. It's not really making more, which often is kind of the bone marrow is suppressed, which is extremely concerning when you have an infection somewhere. The other thing is on ultrasound, her intestines were very thick, like everything was very thickened. And so we suspected that she had something called Panleukopenia. Can you spell that?
No.
Do you want to try?
No.
Does our daughter get her spelling from you?
Probably, unfortunately.
So Panleukopenia, so pan is like multiple and leukopenia is like white blood cells being low. And it's actually a condition where there's a virus that's similar to the parvovirus in dogs, and it can cause the intestines to thicken. It can cause fever. It can affect the bone marrow, and basically cause vomiting, diarrhea, and they will pass away because their blood sugar will get low. They can't maintain their temp, their fluid volume, and it's extremely serious. If they're not treated, they die pretty much. If they are treated, it's like a 50 to 75% survival rate with aggressive hospitalization. So these cases are so hard for me because I want to give these cats a chance, right? But if I'm telling you, hey, you've had this cat for a year, it has no vaccines, I'm pretty sure it has this possibly deadly disease, I can do hospitalization, I can do all these things, but all I can do is, there's no direct treatment for it, right? I can just support them through it. And you have a 50 to 75% chance your cat will live. And on top of that, it's going to be, $2,000 to $3,000 every 24 hours because of all the things we have to do. That's a hard conversation to have because, an owner wants to give them a chance and they want to help, but I want to be as honest as I can about the guarded prognosis that it is. What would be, I'm scared to ask you, what would be your thoughts or questions if that was happening? I feel like you're so logical about these things, but can you see where that would be hard for pet owners?
Yeah, I mean, it's very difficult. I'm with you. I think you want to try to give your pet the best chance possible, but you also have to look at quality of life, and realistically can't afford, 6 to 8 grand for a flip of a coin, whether they're gonna fight through or not.
Yeah.
So that's a tough conversation to have. But I think as a veterinarian, your responsibility is to be upfront, be honest, lay out the gold standard of medicine, and then kind of work into the budget they provide or support them if they make a tough decision.
Yeah.
It's not your responsibility to judge, but it's, to support them through tough decision.
And I will say, like, one of the things I feel like, and it's probably just because I'm older and I've done it for a while, I feel like I'm pretty good at saying, there is plan A, B, and C, but there's also D, E, F, right? And trying to work with somebody to give them options and support their pet and not make them feel like they have to do the gold standard. But in some cases like this, there is no middle road option.
Yeah.
Like, they already tried to give this cat some things and send it home. It didn't do well, right? And so that's where it gets harder. And this might help some of the younger vets and vet students that listen to this, but what I'll often say is there's a lot of things that we can do. It can add up really quickly. There's some things that I'll tell you, I can do this. It's going to cost this much and I will fix your pet. I said, but this is one of those conversations where I can do this. It's going to cost a lot. Emotionally, mentally, financially, your pet's going to go through a lot. And I cannot guarantee you that I can pull them through. And I think putting it that way helps people a little bit. And a lot of people don't want to be the first one to bring up euthanasia, when you're the veterinarian. You try to kind of leave the door open for them too. But in these cases, I don't want to say that's the decision you should make. But what I'll say is, unfortunately, it's a true emergency and we either have to do like really aggressive supportive care or we need to consider quality of life. And the one thing I'll add on that I think help people is, whatever you decide, I'll support you. Like, if you decide that today's a day, like, I'm here to support you, because I think pet owners do worry about the judgment that we might
100%.
put on them,
Yeah. And I think the industry needs to recognize that and be more aware that sometimes you need to support.
Yeah. Yeah. And fortunately, this guy, he was super nice. He wanted to give the cat a chance. Some of the things that, I forgot to say too, one of the things we did diagnostically is there's not a test for this that is a quick point of care test, so meaning you can run it quickly in the hospital. You can send out like a PCR checking for the DNA, takes 3 to 5 days. By then, like, the cat's dead, right? So what they found is you can do a canine parvo test and you can swab. And that actually can be positive for this because the viruses are so similar. So we did the canine parvo test. I did a no charge just because I wanted to give him like more of a definitive answer. It popped up positive pretty quickly. So I was fairly confident with everything that it was panleukopenia. And the poor prognostic indicators are low blood sugar, hypothermia, low albumin, certain things that basically show your body's just shutting down. She didn't have any of that. And so he did agree to hospitalize her for 12 hours and see how she did. And she just didn't perk up at all. She started having pretty nasty diarrhea on top of, being nauseous. And so he did decide to put her to sleep, but it felt like he gave her a chance. And I think more importantly, I was able to give him an answer.
Yeah.
Because that's one of the things, I want to give owners an answer in the ER so they can make a very informed decision. And I don't want them to feel like they're just guessing. So sometimes I will, give away something like a canine parvo test to be able to say, okay, this is what it is. And this is very serious. And it kind of helps them a little bit more. So that was a sad case, but it was also an interesting one because it's not as common because the vaccine works really well. But when you have more strays or younger cats.
Yes, the question is if this cat, would have been vaccinated at an early age, does this probably not occur?
Yeah, and the vaccine works great. It's the FCRVP vaccine, and it provides really good immunity, similar to the parvo vaccine in dogs. I mean, it's really hard to work and see pets that are dying from a preventable disease. And then also to have people say like, oh, it's so expensive, to do this, or you guys are charging so much to try to save my pet, right? But on the flip side, and this is where it's really hard not to be judgmental because some people just don't understand these things and they're not aware of vaccines and how well they work, right? But as we've seen more of an anti-vaccine movement in general in the world, like we are seeing some of these things that we weren't seeing as commonly. And it's frustrating that, you could have gotten a $25 parvo shot and now your puppy's dying, but you're mad at me, right? This guy was super nice and understanding, but those are the things that the two sides of your brain as a veterinarian sometimes are saying.
But I think VetMed needs to do a better job of educating. I mean, there's platforms out there, TikTok, Instagram, Facebook, etc., that allow veterinarians to tell the truth and get that information out there. And that's a great platform to do that.
I think a lot of us are, and we're trying, but there was a wild video the other day on TikTok, and it showed a cat that had rabies. It was a very, clinical case. You looked at this cat, it had hydrophobia, so it was scared of water, and that's really common with rabies. And I went to the comments because I'm just like, okay, they're showing rabies exists. This is what's happening, right? The comments were wild. There was so many people that were like, no, you can treat rabies. No, rabies is survivable. Or, oh, you're just wanting people to vaccinate so you make more money. I mean,
that's what I'm saying. There's so many uneducated that are
I know, but then you show them on social media, you have a video and people still don't get it. And I think that's the harder part is sometimes when you're trying to educate on social media and you have the best intentions, it feels very discouraging.
100%.
Depending on what side of TikTok it ends up on, right? So doesn't mean we're going to give up, but it does mean that it's just something that if you're going to do social media as a veterinary professional or anybody in general, you just have to know that your intentions have to be clear, what your goals are have to be clear, but you can't help what people do and don't decide
it's
to
just
take
everything else. Those 80-20 rule. I mean, 20% of those people are never going to get it. And they're probably going to be loud and outspoken, but you're still reaching 80% of the population. It's okay, this makes sense.
That's true. That's true. Okay, let's get into something else. The VEG, which is the ER that I work for, put out the top 5
Veterinary
breeds.
Emergency Group for
people that don't know.
No, it's a new name now.
Oh, no. Now it's VEG ER for pets.
VEG ER for pets.
It's not Veterinary Emergency Group anymore. I had to retrain how to answer the phone.
VEG ER for pets. Straight clear.
But they put out their top 5 breeds that were seen in the ER this last year. This is
Frenchies, Labs. What else?
Oh, well, those would be 2 of mine. So if I was making this list, here in Texas, Goldens, Frenchies, Labs, Chihuahuas, we see a lot of bully breeds, just all of those, right, would be really, really common. This list is wild because this list is not that. So number 5 is terriers, just like terriers in general.
I figured they live through everything.
I think they get into everything because terriers used to be like rat, type dogs. So I think they eat stuff and get into stuff. And they're also, some of them are prone to pancreatitis type issues. So Boston Terriers was number 4. They, are smush-faced dogs, which means they can have more respiratory things, but then also have the terrier component. Number 3 was Pugs, another brachycephalic smush breed dog. So very interesting. 3 out of the 5 in this top list are brachycephalics. Number 2 is what I think is number 1 in Texas, which is the French Bulldog. There's not a shift in the ER in Texas that I don't see at least one French Bulldog. The most I've seen in a shift coming through the door is 6. They just are very cute, but they are genetic hot messes. And people say, not if you go to a good breeder. Even if you go to a good breeder, you have to prepare yourself that you can end up in the ER if you have a Frenchie. But the number 1 dog that was seen in the pet ER in VEG this past year, you would never guess this, and I would never guess this. They said it was the German Shepherd. That's just not, it wouldn't be on my radar. If you gave me 100 guesses, it wouldn't be on my radar. And it's very strange because a lot of times we'll see a lot of smaller dogs in the top 5, and it's because we have locations everywhere, and especially New York, big cities.
Pocket dogs.
So they don't have, huge dogs. But German Shepherds being number 1 is the wildest thing.
I don't know that.
No. I mean, I've seen German Shepherds because they're big dogs, so they get cancer, they get splenic ruptures. I mean, they can get infections. I see them for, wounds and things like that. But you just don't see them like I see all these other breeds. So I don't know. I don't know if someone who was doing the statistical analysis got Labs and German Shepherds flipped, because Labs not being in the top 5 list is the wildest thing that I've ever seen. Speaking of Labs, so I asked the question on social media. We made a dog vomit the other day in the ER, and it vomited up what we were looking for, but then it vomited up like an additional toy. Yeah, right. So I like asked people, if you have ever like made a dog vomit thinking it was going to be one thing, what else did you get? And so I got a ton of answers. At Emily_Brush said, we induced for a sock last week. We ended up with a sock, 3 corn cobs, and a tampon, which lucky dog, because corn cobs are like the worst thing that you can do. At McKenna Shea said that a dog was not acting right. Owner didn't know what it ate, made it vomit up. It had 23 unwrapped, unused, thank goodness, condoms that it had eaten, just like the
Wow, my
packaging.
man was.
Yeah. I'm like 23.
Yeah,
That's
wow.
strong. At Sam Tetlock said, we induced for a bouncy ball. We got that and a pile of Legos. Like
Not
Legos,
surprised.
like Legos don't seem like something that you would want to eat, At Liz plus the Sheltie said, we induced because we knew they ate a burp cloth, but we also go back 7 shredded bottle nipples, which I will say there's so many people with young babies.
Is that all these relate back to young kids and
Oh,
babies?
absolutely. And people will think, oh, we just lost the pacifier, like going out to eat or whatever, like they just go missing. And you're like, oh, but we have seen so many times that all of a sudden the dog's vomiting and they have like 4 in their
I mean,
stomach.
even the Legos probably have like,
Kids everywhere.
Ice cream on them and popsicles, juice all over them. They probably smell good.
This one at Bay 1710 said, we induced vomiting for rheumatoid toxicity, which is an anti-inflammatory. And we ended up bringing up 3 socks along with their rheumatoid. Like some of these things, I'm like, that's great, because then they didn't end up having,
Circuit.
Yeah. This one said, one of my own dogs at Vet Mama Mo, which I love her. She said, my own dog vomited up some of my little kids' blocks when I induced for ant poison. This one is kind of gross, I'll be honest. But this is at Kim13 said, the dog ate a ball. And so they were making it throw up.
UPS guy showed up.
Deliveries for Christmas. Ranger, it's okay. So they made him throw up for the ball, but I guess they're in a city area, and he threw up human feces also with it. I know. I was like, that is too much. It's too much. Oh, let's let them do that. And then this one is another one. Dogs are gross. At Dana Marie 85 said that we pre-medded a Pyrenees for a spay. She vomited when they gave her the meds, which can happen with some pain meds. And she vomited up the entire intestines of a dead calf.
Ugh.
So she was like guarding cows and that happened. But anyways, dogs are gross. This is wild. But I was like,
our dog is throwing up a lot of stuff.
Our dog does throw up a lot of stuff. Our dog that's apparently, keeping us safe while things are being delivered.
He's not a fan of the UPS, FedEx, Amazon drivers.
Not a fan at all. Okay. Is there anything else that you want to share?
I don't think so.
I was going to answer this question that was sent. I have to go back to it because I had the vomiting stuff up. And this is something we've covered before, but I get asked it a lot. And so I thought I would just address it again because I got a new question about it. So at Kirsten_country man said, hello, my name's Kirsten. I'm a 3rd-year vet student at Cornell. Congrats. I've been following you for a while and love your content. Thank you. I saw that you did an equine internship and ended up in small animal ER. I'm wanting to do rural mixed animal practice and own a practice eventually. I am in northern Nevada and unfortunately do not have much large animal mentorship. So I was planning on doing an equine internship and then working in small animal GP for a while to get the experience I need before going out to like kind of more rural central Nevada to practice. There's currently no vets in the area, so I would be completely on my own. I was wondering if you had a video explaining how you got to where you did and your experience transitioning from large animal to small animal, or if you had any thoughts or advice on my current trajectory. Thank you very much for your time. I love your videos. So thanks, Kirsten. I appreciate that. What do you think about my trajectory?
I think it's probably more normal for the industry than abnormal. And that's the beauty of y'all's license, that you can go out and do what you want to do and pivot when you need to pivot.
Yeah. I mean, I love the thought process of, I know where I'm going. I want to be a practice owner. I know where I'm going to practice. I know I'm not going to have as much support. I will say I had the same sort of thinking because when I graduated, I was going to do, equine ambulatory in this area, but I knew I'd be in a truck by myself, no technicians. And so I really had to be prepared to handle things. So I did an equine internship to kind of see as many cases as possible and get as much hands-on as possible. And I intentionally picked the one I did because I knew I needed that and they were very hands-on. But it also was working with specialists so I could learn like the highest quality of medicine. So I think her thought of like, I know I need to work a couple years under somebody, get good mentorship before I go completely on my own is really important. And I would just encourage her to go somewhere that's like a busy high volume practice, but also does have support so that she can just see as much as possible and learn as much as possible as quick as possible. And then I really do think nowadays with how connected everybody is, as long as you know that you can call somebody, you can look things up. I don't know that there's as much, concern for being out on your own. Because I just think about even when I did it 16 years ago, I had friends that I knew were doing different things and we called each other and talked all the time about cases. We sent pictures. And, one thing is a lot of owners don't always expect you to fix everything right away or know everything right away. And so it's very reasonable to say, we're going to do these things, but I'm going to look into this and we'll circle back. But I do think that the personality of someone who's wanting to do mixed or do equine does also do ER really, really well. Like you've talked about that ER kind of fills my cup like equine used to, because you just have to show up places and you just have to like get the job done and figure it out. But I do think, being connected with really good mentors, even if they're not right by you, is helpful. And then spending maybe, how long would you say, like 2-3 years just working at places that you are getting a lot of experience in a lot of things before you're completely on your own, I think is also helpful. I sometimes wonder, when do you think I was ready to be a practice owner? Like how early in my career do you think I could have owned a practice?
You could own a practice pretty early on, but that's mentality driven more than anything.
Yeah.
I think the reality is your vet career is long. I mean, you're going to spend 40 plus years practicing medicine. If you need to spend the first 2 or 3 years really getting a solid base, that's a short time frame in the grand scheme of things. So go do it. Also, don't let other people convince you to not do something you want to do because the money's better, the hours are better, or whatever it is. Go do what you want to do, but understand at any point if you're not happy, you can pivot.
Yeah.
And I think that's maybe sometimes people overthink out of the gate what they need to do. Don't overthink it. Go with your heart, go with your gut, do what you want to do, and then always understand that you can pivot and, do something different as needed.
That's actually great advice because I think you and I, anytime I have an opportunity or we have an opportunity, our thing is what's the worst case scenario? And really, I'm always going to be employable. I can always make a living as a veterinarian. It may not be doing whatever I'm going to try, but it's not like I won't be able to make a living. And so there's really no reason to not try in those circumstances. And I do think that you hear people say like, I wish I hadn't become a vet, or I'm in a couple practice owner groups. And I mean, people will just talk about how horrible it is owning a practice and how they wish they weren't doing it. But when you dive deeper into those situations, some of the things that they have done and choices they've made or choices they're not willing to make are setting them up for a failure.
100%.
And so it's frustrating for them to just say, don't do this because I hate it. But then you're talking to them and you're like, well, yeah, no wonder you hate it because you've kept that toxic employee that makes everyone's lives miserable, because you're scared to be short-staffed for a little bit. Like there's little things or you haven't set boundaries at all and you work all the time and you are missing out on your family, or you won't hire somebody because you don't want to take the time to mentor, someone young, yet you're overwhelmed and booked out and frustrated. So I do think that she's thinking right in the way that she's doing it. And I love your point of this is a long career. I am impatient. I want things to happen.
And I think most veterinarians are, right? I mean, the personality to get into vet school, to get through vet school, to, do this profession, everybody has a drive and a sense of ability to do stuff that not everybody in every career has. So I think that creates a sense of urgency sometimes. It's not really there.
Yeah.
But it's just a personality that is causing that.
Yeah. So I think that your point of it's a long career and setting yourself up with a strong foundation is going to make you more successful in the long run, and having good mentors will also, I think, is great. There are some good resources I can just shout out. So Dr. Christine Staten, veterinary MBA.
I'm drinking out of a veterinary MBA
Yeah.
Yeti coffee mug right now.
She has a lot of great resources if you want to be a practice owner, or if you are, for a lot of support and learning, which I think is great. Dr. Emily King just launched Vet Practice Pro, I believe. And so they are also giving you really great info, especially about like culture, a lot of leadership training, things like that. I think one is more nuts and bolts of how do you actually, do it, and the finances and the insurance and all that stuff. And then one is more the cultural side of being a leader. But there's a lot of resources that you can start to grow some of those things and really envision what you want in a practice and as an owner. But we have owned our vet hospital now for almost 4 years, and I would give us a good grade because I think we are doing well. And really, I don't think I spiral as much as other practice owners do.
I would agree.
But I will say that's a testament probably to having you as my partner and somebody that I can really talk to.
With that being said, there's a hospital for sale in Fort Worth area.
No, not happening. Okay. Well, on that note, I think that was a good wrap up of our lives and to catch up with everybody. Kirsten, hopefully that helps you. If you have other questions, definitely reach out. If anyone else wants to leave a review or comment, we would love to hear your feedback on anything we talked about. And again, you can listen to us on Apple or Spotify. You can watch us on YouTube and follow us at Questions with Crocker and send me questions our way. Anything else you want to add?
That's it. Now it's time to go to work.
All right. We're going to work. You guys have a great day. Thanks for listening. Bye.